Welcome. Today I'm talking about the ice machine that I will be using when I come home from the hospital after my surgery. The surgery is going to be on my cervical spine. I am having some procedures and a fusion. I have spinal cord compression above and below my previous fusion. So this one is going to clean up everything and do a fusion to include the levels above and below my fusion. So my last fusion was at C5, C6 in 1992. I'm going to have a hardware plate and screws. And at first I had trouble wrapping my head around that, but I have spinal cord compression, so I need to have it done, so I was able to come to terms with it. They recommend the ice machine to help control pain and swelling after the surgery. And I was familiar with the ice machine and actually had it when I had my knee replacement. And my son, after I recovered from that, he said, "Do you really want to keep this thing?" And I said, "Yes, who knows, I might need it again in the future." And sure enough, I do. Can't use the knee replacement pad, but I had to buy a pad that will go around the neck brace, and I was able to get that off of Amazon. The last time I bought the ice machine from Amazon as well, because it was the same brand the doctor's office had, and it was less expensive. Unfortunately, Medicare does not pay for them. At least they didn't in 2021, and this is 2026. And they say it's recommended. That's why I'm thinking Medicare probably still doesn't pay for it. But if they do, that's wonderful. But I already had one, so I just bought the pad. So I'm going to show you the machine. It looks like a little cooler. You would think it was a cooler until you look inside. And show you the inside. There's a water pump. And what you do is you put drink bottles that have been filled with water and frozen in here, and then you put water in, and it circulates the water. It has this these hoses. One is coming, there's two hoses inside this blue foam thing, and one takes water, the cool water from the cooler to your pad, and the other one brings the water that was used back so it can get cooled again, and then it just keeps circulating. This is the pad for the neck, and it will go around, and it has two straps. This is one of them. And here's the other one. So they'll keep it on around the neck brace, and we'll cool it down, and I won't have as much trouble with swelling. When I had my first fusion, they didn't have these, and I did have problems with swelling. In fact, on the way home, I had trouble breathing because of swelling, and we had to elevate the seat more than what the doctor said, because it was like I had this feeling I couldn't breathe. So I'm looking forward to using this. I can show you the knee pad. I still have that one. This is the one that went around the knee, and it worked very well. You can see the little connections, and they go into this tube. If you ever have to have surgery and the doctor recommends an ice machine, I strongly agree. I could not have gotten through my knee replacement without it. I had a lot of swelling, and the swelling will increase the postoperative pain because it presses on the tissues. So I used this, we became very good friends, my ice machine and me, and it was very helpful. But you have to do what's right for you, and I'm not a medical expert. You rely on your doctors, but I thought it might be interesting to see, so I decided to share. And I am in the process of trying to get all the ducks in a row so I don't have to do it all at the last minute. I don't have a surgery date yet. I still have to see an ear, nose, and throat doctor because I had a previous fusion. They want to check to see if there's any damage to my vocal cords. I don't suspect that I have damage because I've been able to speak fine, but I am sure they want to know if there's prior damage, um, because they don't want to be responsible for the prior damage, would be my guess. At any rate, thanks for watching, and I hope you have a great day. Until the next video, take care. This is Gia from Jolly Pond Living.